Can one have a traumatic brain injury and/or an abnormal DTI scan without having experienced a loss of consciousness?
Yes, absolutely. Most intense trauma victims, accident victims, do suffer from loss of consciousness, but not all. We have encountered and imaged many patients who had significant trauma, but they didn't lose consciousness. But later, a week, 2, a month, they developed real symptoms. They came to us, we did a DTI scan, and it demonstrated unequivocally that there's traumatic brain injury at the microscopic level. So yes, you do not need loss of consciousness to have traumatic brain injury. We've seen plenty of patients with ostensibly mild trauma, a slip and fall in a hotel lobby with a wet floor and no wet floor sign. They hit their head. That's about what, a 4 or 5 feet sort of fall. It doesn't sound like a lot of trauma. And indeed, they brushed it off. They didn't lose consciousness. They got up, they went about their business. But a few days later, a week later, they started experiencing symptoms, mood changes, sleep disturbance, speech abnormalities, personality changes. Indeed, these are the telltale signs of traumatic brain injury. And that ostensibly mild injury, which the patient did not suffer loss of consciousness from, still causes microscopic traumatic brain injury. So, loss of consciousness after trauma, ominous sign, high correlation with traumatic brain injury that would be demonstrable on DTI scanning. True. That being said, it's not a sine qua non. You do not need a loss of consciousness to suffer from traumatic brain injury. In another video, talk about the signs and symptoms of traumatic brain injury. Please check that out. I'll list them off quickly. If you have a grossly abnormal CT scan after trauma, gross bleeds, epidural hematomas, subdural hematomas, subarachnoid hemorrhage, intraventricular hemorrhage, diffuse axonal injury, these are almost high correlation with traumatic brain injury at the microscopic level. DTI would likely be positive. Loss of consciousness, we just talked about, high correlation. It's difficult to put a number on it, maybe 80+% or something like that, correlated with DTI positive traumatic brain injury. After that, there's a constellation of signs and symptoms to keep in mind. These are correlated. The more there are, the more they're correlated with DTI positive traumatic brain injury. We're talking memory, concentration problems, depression, and anxiety, mood changes, personality changes, bursts of anger, difficulty in thinking, planning, critical thinking, sleep abnormalities, and speech abnormalities. These generally make up the conglomerate of signs and symptoms that indicate traumatic brain injury at the microscopic level. If your client has one of these and you don't believe malingering is present, that the symptoms are real, you may want to consider traumatic brain injury. And if you'd like, we could do a DTI scan for your client and we could see if the traumatic brain injury is actually there, the white matter level.